everyone, my name is Shira Koshkaran. I'm a board certified physician associate specialized in aesthetic medicine. Today I'm going to talk to you about temple filler. So if we take a look at my lovely diagram here, this is comparing a 25-year-old and a 65-year-old, and it's basically showing the aging process. If you take a look and specifically focus at the temple area, you can tell that the fat pads in the temple area shrink with time, and the bones also unfortunately shrink with time. This leads to further temple hollowing. Some people tend to age and have more hollowness in the temple region than others. By using dermal filler, it can provide more volume, get rid of that hollowness, and overall provide more of a contoured and youthful appearance. Additionally, by treating those temples, it can help provide a brow lift. By losing the volume in this area, it can make the whole upper face just look more saggy. So if someone feels that their eyes are closing, their brows are falling, in addition to doing tox treatment to give a brow lift, by adding a little bit of volume to the temples can further enhance that lift.